All right. Well, welcome everybody. I hope you're having a great Thursday. The sun's shining wherever you are, and we got a special day today, don't we, Spin?
Got a great one.
We really feel like we do.
This is one of the better ones.
Yeah. It's better because you're not going to really be hearing from me and Spin today. So we got a special guest, Tim Brousseau with Deft Research. Tim, how you doing, brother?
I'm doing fantastic. How are you fellas doing?
We are good. You know, he's got an extra bounce in his step because he lives in Phoenix. We're here in Illinois, and we're just glad it's above 13 today. We're happy about that. The sun's shining. But welcome, Tim. Thank you so much for coming in here and doing this for us. For those of you guys that don't know Deft Research, and I don't know a whole lot about them, but I can tell you this. We're obviously a partner with Integrity, so is Deft. And I have heard these guys talk to the Integrity partners maybe 3 or 4 times over the last year or so. And it is always so informative and just, it really makes you grateful that we're all on the same team. So Tim, I don't know for sure what all you've got planned today, but we're really glad that you're here with us, and let us have all you want to give. And if we have questions along the way, I'm not sure how we're going to do this, Jason, if we're going to.
Yeah, just pop your questions in the chat and the Q&A. And
we'll just keep it real loose and keep going. And we've had a little bit of trouble here on our end with the camera, but Tim's is good to go, and we're just going to turn it over to you, brother.
Really, really appreciate that, Jeff, John, Jason, Rebecca, Steve, everybody over at New Horizons. I mean, they always say high seas raise all ships, and us being part of the Integrity family, we're trying to do everything we can at Deft Research to bring our industry insights to our partners to better them, better their downlines, and just overall do a better job servicing the senior beneficiaries in this space. Little bit about Deft Research. We are a full service market research firm, but what makes us unique is that 100% of the work that we do is in the health insurance space. So there's a lot of market research firms out there, I'm not going to lie, but they might do consumer packaged goods and transportation and pharma. That's all well and good, but at Deft, all we do 365 days a year is ACA, commercial group, Medicare, and Medicaid. That's it. We're all in. Granted, we do give our researchers the weekends and federal holidays off. We don't work them to the core, but you know, a lot of work we do at Deft is around these syndicated studies where we try to keep our thumb on the pulse of what's going on from a market point of view, from a carrier point of view, but maybe most importantly, from the consumer's point of view. So we'll survey thousands of consumers every single year to better understand what makes them tick. Why are they doing what they're doing? Where are they going? In the case of the AEP that we just had, and I'm going to share with you some data that's hot off the press, it's 11 days old, that we pumped out in the industry. We're going to talk a little bit about what caused these consumers to shop and switch, and how we need to think about the role that we play as agents, but also the key role of supplemental benefits these days. So when you think about the proliferation of supplemental benefits over the last several years, it's not just vision, dental, and hearing, which have always been very big in the minds of senior consumers, and they will always be important in the mind of senior consumers. But when you start to see all of these other supplemental benefits start to become offered, MA is not just differentiated between Med Supp in terms of supplemental benefits, starts to create a huge differentiation between MA plans. And we start to see that consumer awareness, consumer utilization, consumer desire for these supplemental benefits can be enough to get them to make a move. It's important that we think about that for our existing books of business, our existing clients, but also when we're trying to drum up new business, when we're trying to talk to boomers that are coming into Medicare for the first time, when we're trying to talk to beneficiaries that might be 68 or 72 or 77 that are going through yet another AEP, or through the OEP that we're going through right now. Just going to share with you some highlights, probably take up maybe, I don't know, 15, 20 minutes, and then we'll open it up to some questions after that. So Use me for 1 second while I share my screen here. And again, we at Deft Research will survey consumers for all lines of business. Our hands down most popular study is our Medicare shopping and switching study. This looks at marketing implications, sales implications, product implications, a full debrief of what happened. I'm just going to share with you some highlights. This past AEP, we all hoped and desired and wanted it to be better than the previous AEP, right? The previous AEP, we had the general election that was fighting for the White House and both chambers, not to mention state and local government seats that were out there. But we also had the second wave of the global pandemic. Last AEP was right before the vaccines were available. And we saw that consumerism was down. Consumers didn't want to make the types of changes they had in the past. They didn't want to meet with sales distribution channels face-to-face like they had in the past because quite frankly, there was a lot of uncertainty. There was a lot of fear that was out there. Understandably so. But, as things have evolved, as vaccinations had become more prevalent and more utilized, we were hoping that this past AEP was going to be sort of this big resurgence. And we did see some differences in the market, but unfortunately, we didn't see a whole bunch of consumer activity like we had in previous years. So we're going to talk a little bit about what we saw this past AEP and then some of those benefits or some of those changes that we saw that got consumers to actually make a move and how we need to use these insights to update our strategies, our playbooks, our talk tracks for consumers moving forward. On the left-hand side, when we look at consumer behavior this past annual election period, we saw that actually over half of senior beneficiaries stood on the sidelines and just watched the annual election period just roll on by. 56% said, you know what, I didn't do anything. And it's not uncommon for us to see a number that large of senior beneficiaries, because if you think about it, nobody likes to shop for insurance. We don't like to shop for homeowners insurance every single year or car insurance or renter's insurance. It's just not in our nature. And senior consumers are the same way. It typically has to be some negative experience with their plan, negative experience with their benefit, something that causes them to make a switch. Now, we did see about a third of consumers out there, 34% left-hand side, they did kick the tires, read some direct mail, maybe met with an agent or broker, dialed that unfortunate 100 phone number from some washed up NFL quarterback that was out there. But those consumers at the end of the day ended up staying put. And we see in that gray box on the left-hand side, when we look at total activity this past annual election period, 11% of consumers were on the move. That was actually the same number that we saw last year. Now, on the right-hand side, we're looking at a 4-year trend of all the consumers that make a move, where were they coming from and where did they end up? And we see in that top set of bars there, 6 out of 10 consumers year over year for the last 4 years, when they made a move, it was going MA to MA. We have to realize that MA is a product line that's continuing to grow. Once people get into Medicare Advantage, the likelihood of them leaving and going somewhere else is not as great as we see in that second set of bars. From one MedSup plan to another. Look at just 3-4 short years ago. Orange bar 2019, almost 3 out of 10 switchers that did so during the AEP went MedSup to MedSup. Now, if you look at that blue bar, this past AEP, now it's just about a fifth, 21%. We do see a fair amount of consumers going SUP to SUP, but we're seeing a decline in the number of consumers staying in MedSup. If you look at the third set of bars from the bottom, over the last 3 years, about 10% of consumers who switched during the AEP are going from SUP to MA. Seniors on a fixed income, depleting their assets 3 to 5% every single year. MedSup premiums for some plans in some markets go up what? 7%, 9%, 11% every single year. Hands down the most amount of money they pay for that policy. They don't like high premium rate increases. To combat that, you've got what, 2/3 of MA members that are in $0 MAPD plans. no premium in an MA, not to mention the proliferation of PPO networks. Number one reason why consumers love MedSup, no network, no network, no network. Well, if you look at it from the Medicare Advantage point of view, now we're seeing more and more MA plans offer network flexible PPO options, not to mention all of the supplemental benefits that you don't have to pay a standalone rider to get an MA. They're typically embedded. But what we're also seeing, and we have been advising our clients on this over the last several years, don't sleep on consumers that are in original Medicare only. You'll see them abbreviated as OMO on the right-hand side. Look at in the middle there. 6% of consumers that switched went from original Medicare only to Medicare Advantage. Original Medicare only folks, we understand they're on the lower end of the socioeconomic spectrum. They can be despondent. They can be hard to find. They can be hard to engage. They can be hard to entice. But when you think about the fact that these consumers are simply taking what Uncle Sam affords us when we turn 65, with these privatized options like Medicare Advantage, lowers their cost shares, loads up the supplemental benefits, it's a very compelling option that's out there. Again, Medicare Advantage is growing 45.5% penetration rate in the MA space. That grew 1.5 points from December. It grew 3 percentage points since last January. This is a product line that's continuing to grow, and it's stealing from MedSup. But we're also seeing agents be successful and plans being successful of converting consumers from original Medicare only over to Medicare Advantage. Now on slide 3, left-hand side, we break out this consumerism by MA and MedSup. These consumers don't look the same. These consumers don't always act the same. If you look at that gray box right there, we said the overall switch rate was 11%. When we break it out by MA versus MedSup, you'll see Medicare Advantage at 12, MedSup at 9. We all know the issues around Medicare supplement. It's non-guaranteed issue after a while. You could lose your early enrollment discount. You have to go through medical underwriting if you want to make a change outside of your guaranteed issue. It's almost like there's a moat being built around MedSup that makes it very difficult sometimes to get off that island. Medicare Advantage, so many moving parts, designated annual election period, easy to flow freely between plans and between carriers. Now on the right-hand side, we asked some of these consumers that made a switch, open end, tell us why you did it. And these are some trends that we saw. Blue Medicare Advantage, green Medicare supplement consumers. If you look on the top, an insurance agent, people like all of you that are on the phone right now, told us about a new plan and what it had to offer, which was very similar, but just a little different than the plan that I had for over a decade. This is a legacy consumer that had been with the same plan and the same carrier. But once they actually sat down with an agent and the agent took the time to go through the nuts and bolts of what was available, not just the highest level cost shares, not just let's make sure your drugs are on the formulary and your doctors are in the network, but really looking underneath the hood and really trying to differentiate one plan from the other, it really helped these consumers realize this is an entitlement program for me. I've been paying into this my entire career. I want to maximize what I can get out of Medicare. And here we have an insurance agent who spends the time going through the nuts and bolts, looking deep underneath the hood and finding a little differentiation, which was enough to get that consumer to make a move. Left-hand side in the middle, I am now in a $0 premium MA plan, and it covers dental and glasses. 2/3 of consumers in Medicare Advantage are in a $0 plan. But think about all those consumers that are not in $0 plans. Senior beneficiaries, fixed income, depleting their assets, clawing out of an ugly economy. Now is a time when consumers are trying to count their pennies more than ever. I had that nice retirement nest egg. It took a beating over the last 18 months, starting to look bright again. But keep in mind, $0 premium, low cost resonate with these consumers. And it's not just MA consumers that were happy with different MA options that were out there. If you look in the bottom on the left-hand side in green, this is a Med Sup consumer. I changed from Medigap to MA because there was a $0 premium, $0 deductible, and I had dental, vision, and hearing covered. Think about that. All these benefits come at a $0 premium, network flexibility, $0 medical deductible, $0 RX deductible, loaded up supplemental benefits with the big three here that are talked about. But just think about the endless other options that are out there. Now, as I mentioned, you all play a very critical role in helping these consumers get into the right plan. We heard that from that example on the last slide. The insurance agent took the time to walk me through the differences, and it was enough in my eyes to make that move. Look at on the left-hand side there. When we asked these consumers over the last 5 years, did you work with an agent? Wasn't but 5 years ago in 2018 that we saw only 15% of senior beneficiaries working with an agent or a broker. Now we see over a fifth, 21%. And that number is statistically significantly higher than we've seen over the last several years. And on the right-hand side, kudos to everybody on this call. Pat yourselves on the back, because call it 8 out of 10 consumers that work with an agent are extremely or very satisfied with that agent supporting them. Not only are we seeing on the left-hand side more consumers working with an agent, but we see satisfaction levels so high. Again, the value that you all bring to this industry, the fact that we know senior beneficiaries who are balancing a number of conditions, that are on a strict drug regimen, they cannot afford to have a lapse in care. They cannot afford to have a lapse in coverage. A lot of these consumers don't trust themselves to make a change, whether it's changing plans, changing products, or changing carriers. They want the presence of a health insurance sales professional to help them cross those T's and dot those I's. And that is the value that you all bring to this industry. Now on slide 5 here, we asked about a number of experiences that these individuals who worked with an agent had. And we said, tell us, to what degree do you agree with these statements? Blue, completely agree. Green, strongly agree. All the way to the right-hand side, I do not agree at all. Look at the top. 9 out of 10 senior consumers that worked with an agent this past AEP said the agent was not pushy. 9 out of 10 said that that agent seemed to experience enough to trust. And what about that next one? More interested, this one just hits me hard. More interested in putting me in the right coverage than making a sale. We're not salespeople. We're here to guide these consumers, our senior population, into the right plans that are the best for them. We're going to get compensated either way, but we want to make sure that we're putting that right coverage option in front of them to make the right choice. That's the value that we bring to this industry. We're not pushy. We are experienced. We're professional. We show integrity in everything that we do. And that shows through the eyes of these consumers. Look at that box near the bottom, though. We don't see 9 out of 10 consumers saying this. We only see about 4 out of 10 consumers strongly or completely agreeing with this, that the agent checked to see if my prescriptions were covered by different plan options, or checked to see that my doctors were covered by different plan options. Not taking some of those critical steps, as we know, can lead to rapid disenrollment. And that is a huge knock on this industry. It is a huge knock on third-party marketing organizations. It's a knock sometimes on independent agents, is that sometimes there's rapid disenrollment tied to certain sales distribution channels. We don't want to be pushy. We want to show our experience. We want to put forth the correct and appropriate options. We also have to make sure that we're checking some of those huge boxes for these consumers, again, so that they do not have a lapse in care. They do not have a lapse in coverage. Now, this is a slide that I think is going to cause a lot of people on this phone call, this virtual webinar, to smile. We're looking at top 2 box responses. Remember, strongly or completely agree with those different statements that we made out there about how an agent helped them or the thoughts of the agent. But here we're comparing it in blue, independent agents like yourselves, versus in green, the 1-800 number call center agents. You know, the Joe Namath, the Meredith Vieira, the Jimmy Dynamite Walker, the Joe Montana, the Martin Sheens of the world. There is such a saturation of these celebrity hotlines that are out there. And what happens when somebody calls that 1-800 number? They get shipped off to Florida, maybe Utah, maybe Arizona, where I live. Consumers that are sitting at a cubicle in Utah have no clue about the market in Ohio or Illinois or Wisconsin. Those consumers cannot provide as much value as you can, boots on the ground, live and breathe and part of the community. And consumer sentiment shows that. Looking at the top bar there, 94% of consumers who worked with an independent agent said that was not pushy. But when they worked with the 1-800 agents, that's 11 points lower at 83%. When they work with you, 93% say, seemed experienced enough to trust. But when I called that 1-800 number, barely 3/4 of them said that. More interested in making a sale? 7 out of 10 independent agents. For you guys, 9 out of 10 putting me in the right coverage. There's a clear delineation in the eyes of consumers in terms of where they see value. And it really drives home right in the middle. Look at that blue box. Was truthful. I mean, when you think of integrity, you've got to think of trustworthiness. For you all, 8 out of 10. Under 50% for that 1-800 hotline. That just tells us the value that you all bring to the industry and what we're up against with these 1-800 numbers that are out there today. Keep doing what you're doing. In the eyes of the consumer, they see the value in you. Do they often get duped into calling the 1-800 number? I'm not going to lie, that happens. We're talking a senior population. But the numbers here validate and suggest the value that we all bring to the industry. Independent agents greatly outweighs what we see out there in terms of the 1-800 hotline agents. Let's switch gears here for the last couple minutes. Let's talk about some supplemental benefits. As I mentioned earlier, consumers were talking about reasons why they switched, found a little bit better, got into plans that had embedded supplemental benefits. These are huge differentiators. Slide 8, we ask consumers in MA, tell us what plan, what supplemental benefits did you have offered in your plan last year, going through this past AEP? Look at this laundry list of supplemental benefits that MA carriers are offering these days. Yeah, we all know about eye coverage, telehealth's been around for a while, Silver and Fit, dental. I mean, you start getting down the rung there, in-home safety assessments, transportation, post-hospitalization meal delivery, acupuncture, massage, memory training, brain games, mental health counseling. I mean, there's a lot to be offered in these plans, and we can't just focus on talking about the big 3. If MA carriers are going to invest in them, we want to make sure that we're talking about that, and we see that further play out here on slide 9. This wasn't awareness of supplemental benefits, but we asked senior beneficiaries, which benefits did you actually use as part of your benefit in 2021? Yeah, OTC on the top is super easy. I'm going to go to the CVS every single month to fill my prescriptions anyways. I'm going to the Walmart, the Walgreens. I might as well use that to get front of the store items. But look at all the orange on here for did not use. This just tells us that there can be a lack of awareness of these benefits in the eyes of the consumers. And if product teams at health insurance carriers are going to invest scarce premium dollars into offering these benefits, we want to make sure that we're hyping these up and presenting these to prospects at point of sale. Not only so they have an awareness, but so that they can use them. But we've all run into those grumpy seniors. Why is there a transportation benefit in here? I'm 68 and I drive my own car. I don't need that. they include that benefit, and that just means that my prescription drug costs are higher. Well, that's when you start talking about flexible allowance cards. Did you know that this benefit has a flex benefit that allows you, the consumer, to use it for benefits that are the most important to you? You want to use it for transportation, use it for transportation. You want to use it for telehealth, go for it. You need new prescription lenses, have at it. This flexible benefit is the biggest differentiator that we've seen in the last 18 months in the Medicare Advantage space. Consumers have a strong desire for it. And on slide 10, we see validation of that. When we asked consumers about their preference for supplemental benefits, left-hand side, just over a fifth, 22%, said they prefer to have the supplemental benefits embedded as part of the plan. You determine as a plan what's available, what levels of coverage, how much coverage. But look at the two bars in the middle, yellow and purple. 31% say, I like the menu of options where I get to pick one or two supplemental benefits from column A, 2 or 3 supplemental benefits from column B, 1 supplemental benefit from column C. Or in purple, the 30% that say, I want a preloaded card that allows me to use it wherever I want to use it. This is the differentiation that we are starting to see proliferate in the Medicare Advantage space. WellCare came hot on the scene in 2021 with this flexible card. A lot of companies are following suit now, and we see in the eyes of the consumer that these flexible benefit cards are gaining in momentum because it gives consumers choice to use the benefits how they want to use the benefits. It allows them to see differentiation between what might not be included in their existing plan or the limitations or constraints that they have with their current supplemental benefits to a different plan that gives them that flexible option. Now, John, Jeff, I know we covered a lot there. I had some more slides, but I definitely want to open it up to any questions that anybody might have, regarding what we saw this past AEP or any sort of supplemental benefits that might be out there.
We do have a question just about whether the slides will be available.
I'll definitely throw out some of these slides to you to share for sure.
Hey, Tim, with so many of these supplemental benefits out there, what else should we be looking at inside these numbers? Is there anything else that we should be looking at?
Yeah, that's a great question. And I think the biggest thing is that, I really wanted to drive home. OTC came out a few years ago and was really big. Flexible benefit has been the new topic du jour, but you really have to know your market. You really have to know the competition and what's available, because we start to see some unique supplemental benefits that are really appealing to consumers. Think about the fact that we're starting to see a lot of carriers offer in-home air filtration, air conditioners that are really helping people with asthma and really starting to reduce admissions for people with asthma. We work with a number of carriers in Minnesota that offer, don't laugh, snow shoveling for certain members that have certain chronic conditions, because the last thing they want them doing is trying to shovel their driveway or their front walkway. And so it's really understanding the unique supplemental benefits that are available and that sort of fit the needs of consumers in your market, because that, again, can be just enough of a differentiation to get somebody to consider plan A versus plan B.
Hey, Tim, I'm going to generalize a couple of questions that are popping up. Do you see the majority of these add-on supplemental benefits being pigeonholed towards the HMO plans or the PPO plans, regional, or can you address any of that in your research?
Yeah, so typically we're seeing a lot of these supplemental benefits being spread like peanut butter across all plan types. So the big nationals, the blues, small regionals, everybody realizes we need to compete. What's interesting is that you brought up the whole network aspect of it. Many times with that PPO comes a premium. And to get that network flexibility and to unlock that network flexible PPO, sometimes there's a reduction in supplemental benefits. Sometimes there's an increase in premium. Sometimes there's an introduction of a couple $100 medical deductible. So absolutely, you just really have to look at those options because carriers weigh them for sure. We can't offer everything underneath the sun. It's just not a sustainable model that's out there. But there is a balance between cost and benefits and network that really needs to be geared towards the conversation of individual consumers.
In fact, sometimes I even see two like plans built together, one with no premium, one with a small premium. The one with the small premium does have the beefed up benefits to it, the add-on supplemental benefits. So this could be a way that they're differentiating themselves in the marketplace as well.
Yep.
Anything else there, Jason? Go ahead.
I feel that many seniors called the TV ads versus people stopping at a Medicare kiosk to speak with a Medicare professional agent. Okay, so just a comment.
Just a general comment. Yeah, it comes from Lane.
Was the question that you see more
There was
going?
really one, yeah.
Oh.
Yeah, he felt like he saw more people going towards the TV 1-800 Joe Namath versus the kiosk and I've talked to a few brokers out there that they saw less success, and maybe it's because of the pandemic in some of these Walmart kiosks and some of the places that they can purchase, to sit, and see a vast number of people. So
Yeah, I mean, I think we are almost getting to a point of saturation with the TV personalities, but keep in mind, CMS came out and said complaints from third-party marketing organization enrollees is exponentially higher than we saw last year. And CMS came out and said, hey, we're going to start taking a really hard look at these companies that are behind the Joe Namath and the Joe Montana and the Jimmy Dynamite Walkers of the world. So it's going to be interesting to see how that further swings the pendulum towards the value of the independent agents that are out there.
Yeah, and I tell everybody compliance is our friend, and it is our friend, and not to be afraid of it. But I also think that besides the Jimmy Walkers, they're going to spread their love like peanut butter across everybody. So we're all going to have to be compliant, or at least thinking compliance and obeying some of the rules. We do have a question popping up. Are you familiar with the medical savings account?
Yeah.
In exchange for a high deductible, they're getting some dollars. How do you see that? And we're a big proponent here at New Horizons for the LASSO, the medical savings account, all medical savings accounts. But the true pocket of money, actual money that's being put at consumers. How do you see that fitting in?
Yeah, I mean, I'd say from a research point of view, it is not prevalent enough yet, and I will say yet, for us to get a really good line of sight in terms of overall consumer interest, experience, and intent in that. I mean, when you sit back and just look at the dollars and cents and how it's made up, it's absolutely a viable option, but we don't have any data to really support how that has grown or changed or how consumers view it, just because there's just not that many consumers out there that have it compared to the other product lines.
I agree. Okay. Well, listen, Tim, we're drying up on questions. And unless we see something else, that's okay, because you did such a wonderful job. We really do appreciate everything that you're doing. If you could make those, I don't know if you're going to make those available or not. I'll let you and Jason handle that piece of the equation. If you could, I know we had a couple of people that were asking specifically if they could get their hands on this market research, as much like you were putting it on the slideshow itself. So
yep.
We'll try to get that worked out. And if we can get it worked out, everybody, we'll get it passed on to everybody. Everybody in this chat room is going to be getting a copy. We've recorded this, and you're going to get your own version of Mr. Brousseau's presentation here. I know some people here are saying thank you for doing the research, and because basically I've been touting this all week long as maybe the most important product or the most important webinar that we've put out there. It's a reason, it's where the rubber meets the road in our industry. Why are people moving? What are they moving to? And it just arms that very savvy and very good broker that we've been very fortunate, and all of our integrity brokers are great, but everybody's got some very good ones. So I don't see anything else, Tim, and you've been fantastic. If you've got any last words, I'll give you the last word.
Since this shows the true value of integrity, right? The fact that you all are really looking at, hey, how can we help our downlines be more successful? How can we provide more value? What is the value of integrity? And you look at it and say, integrity has a lot of moving parts, and they have some strategic partners, which is what Deft Research is. And the fact that you all reached out to us proactively and said, hey, can you help us with our downlines be a little smarter and a little better in this space, really, actually, I think shines really brightly on New Horizons as an integrity partner and agency. So just last comments is just kudos to New Horizons and everything that you all have done, and just keep up the solid work.
Thank you very much, Tim. We'll be in touch, my friend.
All right.
Well done.
Take care.
Well done. Thank
Cheers.
you. Take care, bud.
All right,
Bye-bye,
bye.
buddy. Cheers.